President Obama jumps back into the health care fray once again today. And CBS News senior White House correspondent Bill Plante has more from the White House this morning. Bill, good morning to you.
Good morning to you, Jeff. The charge that the president is willing to abandon his demand for a public health care option has really upset his liberal base. So he's reaching out. On Wednesday, in a conference call, he told religious leaders that health care, in his words, was a core ethical and moral obligation. And today, he reaches out to his supporters in an online meeting. Regina Holliday will be one of those online today. Her husband died of cancer the day the Senate began debating health care reform. His death at 39 from kidney cancer prompted her to paint this mural promoting health care reform.
There's a very good chance that if health care reform had gone through years ago, my husband would still be alive today.
Holliday is pushing for a public health plan.
I think the public option is very important. I think competition is very important.
Democrats on Capitol Hill say they may only be able to pass health care reform without Republicans, an idea the White House is knocking down. How do you respond to the suggestion that you've lost control of the argument?
The argument's not over.
But White House sources now say that if liberals want the public option, they'll have to sell it themselves. The president will use his popularity to promote a bipartisan solution.
I say no. We do not have to live with this. We can change things. If everybody stands up.
The president will also take his case to radio listeners today, appearing live on the Michael Smerconish call-in show. Jeff?
All right, Bill Plante at the White House. Bill, thank you very much. And joining us now is former Massachusetts governor and presidential candidate Mitt Romney. He's a Republican and signed a bill providing health insurance for nearly all of his state citizens in 2006. Governor, thanks for joining us. Good to see you again.
Good to be back. Thank you.
Let me ask you the same question that Bill asked Robert Gibbs yesterday. Do you think the president has lost control of this debate?
Well, I think he gave up control at the very beginning. He decided that he would hand this over to Nancy Pelosi and the House. He did not fashion his own bill with the measures that he thought were critical for the bill. And the House has created something which is, frankly, entirely partisan. It's not the kind of bipartisanship which the president promised he'd bring to Washington. Actually, what you're seeing in Washington is the status quo on steroids, where the kind of partisanship which is long characterized inaction in Washington is again prevailing. And if the president wants to get something done, he needs to put aside the extreme liberal wing of his party, work together with the middle votes of his party, work with Republicans as well, and get a plan that gets people insured without having the government take over insurance.
Governor, let me ask you this. Anything you think the president is doing right now on health care reform?
Well, he's out campaigning, and that's what he knows best, which he continues to campaign. But what we really need right now is a president and leadership from the president that works on a bipartisan basis to fashion a bill that improves our health care system, that gets people insured, and make sure that we don't have to have folks losing insurance if they lose their job, at the same time that does not get the government in the business of running health care or taking over the health care insurance industry. That we don't need. We got the job done here in Massachusetts, and we did that without a public option.
But, Governor, I should say that Forbes magazine says the Massachusetts program, quote, hardly looks like a model for the nation or even any other state. What it looks like is a mess right now. Costs, as you know, have gone from $133 million in 2007 to more than $700 million projected in 2009. Are you surprised at how much costs have spiraled?
Actually, that cost figure is almost precisely, actually slightly less than what was forecast when the conference committee put the final bill together. So it's exactly on budget. And the state's cost is about one half that, about $350 million. The independent Massachusetts Taxpayers Foundation looked at the program and said it's well within the initial projections, and it's a modest cost. And the truth is, at 1.5% of the state budget, we've gotten all of our people insured. And everyone in Massachusetts knows that if they were to get ill or if they lost a job, they would not lose insurance. Portability is important. And we did all this without having to have a public option. You don't want the government getting in the business of insurance. It right now is responsible for 50% of all health care in America with Medicare and Medicaid. Let's keep them out of the private sector, the private side of health care, or they're going to become the great monopolist that really changes the way health care is delivered in America.
All right, former Massachusetts Governor Mitt Romney joining us from Massachusetts this morning. Governor, thank you for your time.
Thank you. Good to be with you.